Welcome to this explainer. Today, we're diving deep into exactly how medical science chemically tunes the human brain to treat things like anxiety and insomnia. We're going to look closely at the exact biological mechanisms that can take a panicked, racing brain and transform it back into a calm, resting state. Here's our roadmap for today. We're covering anxiety, insomnia, and GABA, the benzodiazepine era, reversing the effects, the fall of barbiturates, modern anxiety alternatives, and finally, the new sleep agents. Let's get right to it. Part 1. Anxiety, insomnia, and GABA. The problem and the target. Now, we aren't just talking about everyday stress here or catching a fleeting case of the jitters. When we talk about clinical, medical anxiety, we are looking at severe, chronic, and truly debilitating physical symptoms. This involves severe sympathetic activation. We're talking tachycardia, intense sweating, trembling, and palpitations. It's basically a massive physiological storm that severely disrupts a person's life and absolutely requires clinical intervention. So how do you stop that storm? You hit the brakes. Specifically, we target GABA, gamma-aminobutyric acid, which is the brain's natural brake pedal. When GABA binds to its specific receptor, it triggers a central ion channel to open up. Think of it like a gate swinging wide open, allowing negatively charged chloride ions to just flood right into the neuron. Because these ions are negative, the neuron hyperpolarizes. It becomes deeply negative and much harder to stimulate. That decreases neural excitivity and brings the brain right back to a state of calm. Moving on to part 2, the benzodiazepine era, the heavyweights of calm. Benzodiazepines completely revolutionized medicine, and it really comes down to one mind-blowing number: 1,000. You see, their lethal dose is over 1,000 times greater than their typical effective therapeutic dose. This incredible ratio made them exceptionally safe compared to older drugs. A purely drug-induced fatal overdose with these is exceedingly rare. Well, unless they're combined with other depressants like alcohol. So how do they pull off the safety margin? Instead of violently forcing the brain to shut down, these drugs simply help GABA do its job much more efficiently. They bind to a specific, high-affinity site right on the GABA receptor, and that safely increases the frequency of those chloride channel openings. They don't push the brake pedal directly, they just make the brake pedal hypersensitive to the brain's natural foot. Finding the right fit from this family of drugs is totally a Goldilocks situation of half-lives. You've got short-acting drugs like triazolam, which work fast to put you to sleep, but they carry the risk of sudden withdrawal and rebound insomnia the very next day. On the flip side, long-acting drugs like diazepam form active metabolites that can literally last for days. That's fantastic for preventing seizures or prolonged muscle spasms, but it's terrible for sleep because you'll wake up with a heavy hangover effect of residual sedation. Because they are so incredibly good at tweaking that brake pedal, doctors use them for a whole bunch of things. They treat anxiety disorders ranging from severe phobias to generalized anxiety. They manage insomnia. They induce amnesia for conscious sedation, before unpleasant procedures like endoscopies. They terminate active seizures. And they even relax skeletal muscle spasticity in disorders like multiple sclerosis. Part 3. Reversing the effects. The clinical fail-safe. Now, even with that massive safety margin we talked about, it still begs an important question. What happens if a patient actually takes way too much? Or what if they mix it with another central nervous system depressant? How do doctors handle that? Enter flumazenil. This is essentially the antidote. It's a rapid-acting IV GABA receptor antagonist that physically blocks the benzodiazepine from binding to its receptor site. So we have an immediate fail-safe that can rapidly reverse sedation. But, and this is a big but, doctors have to use it very, very carefully. Because it strips away the calming effect so incredibly fast, it can actually precipitate severe withdrawal symptoms or even trigger seizures in patients who are heavily dependent on benzodiazepines. Which brings us to part 4, the fall of barbiturates, the dangerous predecessors. As we discussed, benzodiazepines gently tap the brakes by increasing the frequency of channel openings, but barbiturates, they forcibly prolong the duration of the channel openings. At high doses, they can actually block excitatory receptors and sodium channels entirely. They don't just tap the brake, they literally slam the brake pedal to the floor and hold it there. That can easily lead to profound central nervous system depression, coma, and even death. It's honestly terrifying when you look at why barbiturates fell out of favor. First off, they actually suppress the brain's fundamental urge to breathe by dulling the response to carbon dioxide. Second, they induce liver enzymes, which totally ruins the effectiveness of other medications the patient might be taking. On top of that, they cause extreme physical dependence, and the withdrawal process alone can be lethal, sometimes leading to cardiac arrest. And the scariest part, unlike benzodiazepines, if a patient overdoses on a barbiturate, there is no chemical antidote like flumazenol to save them.
Let's move to part 5. Modern anxiety alternatives, building sustainable calm.
For long-term issues like generalized anxiety disorder, doctors today prefer safer antidepressants like SSRIs or SNRIs. The catch? These drugs take a frustratingly long 4 to 6 weeks to actually kick in and start working. So, to bridge that gap, doctors will often initiate both a fast-acting benzodiazepine and the antidepressant on day 0. By week 4, the antidepressant is finally kicking in and doing the heavy lifting. Then, around week 8, the doctor can safely taper and completely withdraw the benzodiazepine, leaving the patient with sustainable, non-addictive relief. Another really great modern alternative for chronic anxiety is buspirone. This one is totally different. It completely ignores GABA and goes straight for serotonin receptors instead. When it comes to the numbers, buspirone is a fantastic option, especially for the elderly. It triggers fatigue in only 8% of patients, compared to a massive 33% for a typical benzodiazepine like alprazolam. It doesn't have muscle relaxant properties, which means way less interference with day-to-day motor functions and cognitive performance. It's a huge quality of life upgrade. Finally, part 6, the new sleep agents, precision targeting. Say hello to the Z drugs, zolpidem, zaleplon, and ezopicolone. These are non-benzodiazepine hypnotics, but they act like clinical snipers. They selectively target just the BZ1 receptor subtype of the GABA complex. By totally ignoring the other subtypes, they give insomniacs exactly what they need, sleep, without the unwanted muscle relaxant or anticonvulsant baggage. Best of all, they don't significantly mess with your natural sleep stages, so you actually get real rest without ruining your sleep architecture. Plus, there's minimal risk of rebound insomnia. And then you have totally out-of-the-box approaches like Rumeltion. This drug is unique because it just bypasses the whole GABA brake pedal completely. Instead, it precisely stimulates the melatonin receptors to perfectly mimic your pineal gland. It simply triggers your natural circadian rhythm to help you fall asleep. And because it operates completely outside the GABA system, there is zero evidence of abuse, dependence, or withdrawal. It's incredibly safe for long-term use.
So look how far we've come. We started with the blunt, incredibly dangerous instruments of barbiturates, evolved into the much safer modulation of benzodiazepines, and now we're engineering these highly targeted, non-addictive therapies like Z-drugs and Rumeltion. But it leaves us with a fascinating question to ponder. As we continue to perfectly map the complex pathways of the human brain, what perfectly tailored, side-effect-free treatments will we discover next to unlock the ultimate chemical calm? Thanks for exploring this with me, and I'll catch you next time.